Good evening everyone and welcome back to GDC Classes. So hope you all are doing good. So in today's video under the Pharma thunderstorm, we're going to start with a new topic in medicinal chemistry, that is the alpha blocker. Okay. Now alpha blockers, they are it is a kind of very important topic and comes under the sympatholitic drug. Okay. Now starting with the alpha receptors, what are these alpha receptors? Where these alpha blockers are acting? So alpha receptors are the adrenergic receptors, or we can say the receptors of the sympathetic system. Okay, they respond to two neurotransmitters, that is the norepinephrine and epinephrine. These are the two neurotransmitters of the sympathetic system, or we can say the adrenergic system. They both are G protein coupled receptors. So alpha receptors, alpha 1 and alpha 2 receptors, and both are G protein coupled receptors. Alpha 1 is the Q protein coupled receptor and alpha 2 is GI, that is the inhibitory protein coupled receptor. Now starting with the location of the receptor. Now basically the alpha 1 is a type of postsynaptic receptor. Means it will be present in the postsynaptic neuron. And if we talk about the location of this receptor, so there is a mnemonic by which you can remember that where this is located. So white, you can just remember this word white. So from V you can say in the blood vessels. Okay, vessels it is present, and there in the vessels it is responsible for the vasoconstriction. So vessels, then from eye you can say iris. So in our eye, inside our eye, iris, it is present there also, and that is responsible for the mydriasis effect. Then we have bladder. Okay, from B, bladder. So urinary retention for all that is bladder. B, E, eyes. So in eyes for the dilation of the pupil, for that this it is also present in eyes. Then S is for sphincter, or we can also say salivary gland. It is also present there. So white, blood vessels, iris, bladder, eyes, sphincter and salivary gland. That is the alpha 1 receptor location. Talking about the next receptor, that is the alpha 2. Now it is present in the postsynaptic nerve terminal. Okay, there it is present, and not presynaptic nerve terminal. Okay, and there it is basically responsible for what? The negative feedback. Okay, it regulates the negative feedback system. Basically, whenever the alpha 2 blockers act, they block the alpha 2 receptor, and due to that the release of norepinephrine is restricted. Okay, so there the negative feedback works. Now if we talk about the location again in the platelets, then in the pancreatic beta cells it is present, basically responsible for the decrease in the insulin secretion as it has a negative feedback. Adipose tissue, lipolysis is decreased there. Then CNS, there the decrease in the synaptic outflow means decrease in the BP can also be seen there. So that is the alpha 2 receptor. Then if we talk about the alpha adrenergic blockers, so what are these alpha adrenergic blockers? Basically they act on the alpha receptors, and there they block those receptors or the synaptic receptors that are called as alpha blockers. Okay, now if we go on to the classification, there are two types of alpha blockers. One is the selective blocker, one is the non-selective blocker. Selective ones, they selectively act on the particular receptor, either the alpha 1 or the alpha 2, and it will show its action of blocking that receptor. That is alpha 1 selective drug, prazosin, terazosin. All the OSIN drugs comes under the alpha 1 selective blockers, like prazosin, terazosin, doxazosin, 𝘿𝙄𝙎𝑃𝑆. Okay, then we have temsulosine, then we have 𝘿𝙄𝙎𝑃𝑆. All these are the alpha 1 selective blockers. Then we have alpha 2 selective blockers. There we have a drug that is 𝘂𝙎𝑃𝑆. Okay, it acts by the negative feedback system. Okay, and they are basically present at the presynaptic nerve terminal. If we talk about the non-selective one, there are number of classes here. So first is the beta-haloalkylamine, like the phenoxybenzamine. Now they are not selective for the particular receptor. They can act on both, action on both. Imidazolin, phentolamine, tolazolin. Okay, these are two types of imidazolin. Now as they are imidazolin, so their structure will definitely be containing an imidazole ring. Then we have miscellaneous one, chlorpromazine we have here. So this is a type of the non-selective blockers. Then we have hydrogenated 𝘖𝙁𝙾 and the 𝘖𝙁𝙾. Okay. Now starting with the drugs one by one we have here. First is the non-selective alpha blocker. Non-selective alpha blocker means they will not act on selectively on either, but they can act on both. First we have the beta-haloalkylamine. So what is beta-haloalkylamine? Now class is beta-haloalkylamine. So if we break down this word, beta is telling about the position. Means somewhere at the beta position of what? The alkyl chain, we have a halogen group attached. So in the alkyl chain at the beta position we have a halogen group attached, and to the other side we have a amine. So that is the beta-haloalkylamine. So example of this is phenoxybenzamine. So in phenoxybenzamine, if you look onto the structure, beta-haloalkylamine, so here we have a alkyl chain of 2 carbons. This is the alpha position, this is the beta position. Now at beta we have a halogen attached. What type of halogen? Fluorine. Okay, so at beta halogen, then we have an amine group attached. So here we have an amine, nitrogen. This is beta-haloalkylamine. Now the name is phenoxybenzamine. Type of an irreversible drug, irreversible action is seen in here. And if we want to the trick to remember it, so from phenoxy we can remember that it has a phenoxy group. Okay, and from benzene, from benzene we can remember it has a benzene ring too. And then amine, here we have amine. So tertiary amine. So phenoxybenzamine, type of beta-haloalkylamine. So this is the structure. Then if we talk about the uses here, pheochromocytoma, it is used there. What is this pheochromocytoma? It is basically a type of rare tumor. Okay, and due to that rare tumor, basically there is an overproduction of catecholamines that can be seen. Now what are catecholamines? Basically the structures that are contained catechol ring in their structure, like dopamine, norepinephrine, epinephrine, all these are the catecholamines. So basically overproduction of these catecholamines results in the pheochromocytoma, and it is a type of rare disease, but for the treatment of that phenoxybenzamine can be used. Side effects: orthostatic hypertension, reflex tachycardia. Okay, these two are the side effects. Now what is this orthostatic hypertension? Now basically when someone is laying down or someone is sitting, so at that time, after sitting for a long time or laying down for a long time, whenever the person or individual stands, that time due to the gravitational force our blood flow is towards downward, that is towards the leg or the abdomen. Okay, and that results in the decrease in the BP for some time. Now if there is a normal condition, now that BP will be normal after a while, but if there is an orthostatic hypotension condition, now that time the BP will not normalize, it will keep on falling. Now that is called as the orthostatic hypotension. Now next we have the ergot alkaloids. These are the natural ones. Okay, natural sources we get it. If we talk about the uses, the migraine headache we can use it. Then hypotension, rare type of use, but still it can be used there. Side effects: nausea, vomiting, then worsening of the Raynaud's disease, all that under the ergot alkaloid, or we can say ergotamine. Next class we have is imidazolin. Okay, now imidazolin means it will be containing an imidazole ring in their structure, so that's why they are called imidazolin. Now first drug we have in imidazolin is phentolamine. So if we look onto the structure of phentolamine, so from phentol, you can remember it has a phenol. So here we have a phenol. Okay. Then next we have tol, pentol. So from tol you can remember it is a toluene. So here we have a toluene. What is toluene? A benzene ring that has a substitution CH3. So that is toluene. So toluene is present. And it says amine. Here we can say we have a tertiary amine here. So that is pentolamine, and as it comes under the imidazole, it will also contain an imidazole. Now what is imidazole ring? A 5-membered ring with 2 nitrogens at first and third position. That is an imidazole ring. Here you can see this is the imidazole. So that is pentolamine. And if we go into the uses, now it is used in the diagnosis and the short-term control of what? 𝘂𝙀𝙎𝙀, then reversal of the dental anesthetic. Now why? Basically it has a local vasoconstrictor effect. Okay, and due to that local vasoconstrictor effect, for the reflex or the reversible of the dental anesthesia, it can be used. Then side effects: hypotension, reflex tachycardia, arrhythmia, then palpitations. What are palpitations? Basically the irregular heartbeat that can be called as palpitations. Headache, dizziness, nausea, abdominal pain, diarrhea. So all that this pentolamine can be used. Next we have here is tolazolone. Now very simple structure of tolazolone. From name we can remember it. From tola you can remember it has a toluene. Okay, again what is toluene? A 6-membered ring with a CH3 attached, that is toluene. Then we have zoline. So as it comes under the imidazole, so it will contain an imidazole ring. So here we have a toluene, here we have an imidazole ring. They are combined. Okay. So that is they are joined basically. So that is the tolazolone. If we go on to the uses, pulmonary hypertension in newborn. So that it can be used for the newborn ones. Raynaud's disease. Now what is this Raynaud's disease? Basically sometimes due to in the response of severe cold or due to the emotional stress, there is the constriction of the blood vessels in our fingertips, and due to that our tips become bluish in color. So that is called as the Raynaud's disease. Okay, so for treatment of that, tolazolone can be used. Then frostbite, due to the extreme cold weather, frostbite can be there. There is snow and all for due to that. So that for the treatment of that also this tolazolone can be useful. Then adjuvant, it can also be used in the adjuvant of the treatment of pheochromocytoma. Okay, so that are the uses of tolazolone. Then side effects, if we go: hypotension, tachycardia, reflex tachycardia, arrhythmia, palpitations, dizziness, anxiety, headache, nausea, vomiting, abdominal pain, and the nasal congestion. All that tolazolone is helpful. Side effects that are caused by the tolazolone. Now next type of class is miscellaneous one. Miscellaneous, under that we have the chlorpromazine. Okay, that is the drug. Now if we go on to the structure remembering, trick we have here. From chlor, we can remember a chlorine group. So we have a chlorine group here. Then from prop we can remember propyl chain. So here next is prop. We have a propyl chain, and there is a ring that says phenothiazine. Phenothiazine. So phenothiazine means we have a phenyl ring and a thiazine. Thia means a sulfur, azine means a nitrogen. So here we have a thiazine. So this is the structure of phenothiazine along with a chlorine group attached to that phenothiazine ring. Then we have a propyl chain that is attached to the amine, both the sides. So that is the structure of chlorpromazine. Next we have here is, before that, uses. Before going to next, now uses. It is a first generation drug for what? Antipsychotic. Okay, also called as typical antipsychotic. Okay, considered under that class, and it has an anti-emetic effect, and due to this sedation and anti-emetic effect, it is also used as a pre-anesthetic before the surgery. Okay, the pre-anesthetic medication, it can be used for chlorpromazine, a type of miscellaneous drug. Then severe anxiety or agitation, for that also it can be used. Side effects, if we talk about, sedation, extrapyramidal symptoms, neuroleptic, malignant syndrome. For all that we can use this 𝑘𝙀𝑍. Next side we have the selective alpha blockers. Okay, now selective means they will be selective for a particular receptor, and here we are talking about the alpha-1 first. So alpha-1 selective blockers, first drug we have prazosin. Now these all the ausin drugs, they are the quinazoline derivative. Means they will be having a quinazoline ring in their structure. So here we have the quinazoline ring. This is called as quinazoline ring. That is the prazosin. Now how can we remember the structure of prazosin? We have a trick for that. So Queen-Piper field pressure left. That is the thing that you have to remember. Now from Queen you can remember quinazoline. From Piper you can remember piperazine ring is there. Here we have a piperazine ring, a heterocyclic that is present here. Fields. From fields you can remember furoryl. Furoryl is the furan with then double bond C double bond O attached as a substitute. That is furoryl. Furoryl ring is also there. Pressure less. When its pressure is less at antihypertensive. So it is acting as an antihypertensive agent also. So that is the prazosin. Structure is also clear. Now we go on to the uses. So hypertension, for that it can be used. Then we have benign prostatic hyperplasia. Now what is this benign prostatic hyperplasia, BPH? Now this is a type of a rare disease. Okay, basically it is a non-cancerous type. Now non-cancerous type and over the men which are 50 years over, effect to them. Okay, basically here is the enlargement of the prostatic gland that is present in men, and it is a non-cancerous type of enlargement, and due to that enlargement of the prostatic gland, basically the obstruction in the urinary flow can be seen. Okay, so that is the benign prostatic hyperplasia. Then we have the congestive heart failure. For that it can be used. Raynaud's disease, again the vasoconstriction in the fingertips. Due to that the bluish fingers can be seen. The tips of the fingers can turn bluish due to the low oxygen. So that is the Raynaud's disease. Next we have side effects: orthostatic hypotension, dizziness, headache, drowsiness, nausea, mild urinary frequency, nasal congestion. Then we have weakness, palpitations, milder one, but the prazosin can be used. It can cause the side effects like palpitations too. Next we have parazosin. Now all these zosin drugs, they have somewhat similar structures only, just the difference is the side chain. Most of them have similar type of structure, just the side chains are different. So here also in parazosin, the structure is similar to the prazosin only. So Queen-Piper field pressure less. So quinazoline. Then we have a piperazine ring. Then instead of the furan, here we have a tetrahydrofuran. So from para, you can remember tetrahydrofuran. So here we have a tetrahydrofuran. What is tetrahydrofuran? The saturated furan. So tetrahydrofuran is there. That is the structure. Then if we go to uses, hypertension, benign prostatic hyperplasia. For that it can be used. Raynaud's disease again. When we have adjoint in the chronic heart failure. For all these we can use what? Parazosin. Side effects: orthostatic hypotension, it is useful. Headache, then drowsiness, then fatigue, nausea, nasal congestion, weakness. For all that we can use parazosin. Next we have doxazosin. Again similar kind of structure, but the difference is here in the side chain again. Now what side chain? From doxa you can remember double oxygen. Now oxa means something related to oxygen. D, from D you can remember double. So means two oxygens are there in the ring. Okay, what type of ring? Basically the benzodioxane ring is present here. So here we have benzene ring, and to that the oxane ring is attached. So benzodioxane ring, two oxygens are there. Okay, that is the tail. So doxazosin uses hypertension, benign prostatic hyperplasia, it can be used for that. then Raynaud's disease, then adjunctive CHS. For all that, we can use this doxazosin. Then side effects: orthostatic hypotension, dizziness, palpitations, edema, headache, fatigue, drowsiness, nausea, abdominal discomfort, nasal congestion, weakness, mild tachycardia. For all that, doxazosin is the responsible one. Side effects that can be caused due to that. Then next drug we have here is 𝘿𝙂𝙎𝑜sin. 𝘿𝙂𝙎𝑜sin has a somewhat different structure compared to the prazosin, terazosin and doxazosin. In 𝘿𝙂𝙎𝑜sin we do not have a 5' ring here. Okay. In others we had 5' ring. Here we don't have. Here we have a long chain of 3 carbons. Both sides nitrogen attached and phenazolane ring is there, and the side chain we have here is CH. So always uroselective. Now this 𝘿𝙂𝙎osin for the trick L. So from L you can remember always uroselective with the CHF tail. Always uroselective means it will act on the urinary part. Okay, the urinary system. It will act there, so that's why it is called as uroselective. With the THF tail. So tetrahydrofuran we have, so that's why THF tail. Now uses benign prostatic hyperplasia and the lower urinary tract symptoms. Side effects we have dizziness, mild hypotension, then headache, fatigue, nausea, abdominal discomfort, weakness, and rarely palpitations can also be seen. Next we have is the alpha-2 selective blockers. Now I already told you it is a type of presynaptic terminal. It is present in the presynaptic terminal. Okay, the end of the synapse it is present. So it gives the action that has a negative feedback. Okay, it acts on the negative feedback. Then the drug here is 𝘂𝙎𝑚𝑏. Now 𝘂𝙎𝑚𝑏 it is a type of the pentacyclic skeleton. What is pentacyclic skeleton? It has a 5 ring. So that's why called as pentacyclic skeleton. Then indole ring is also present in its structure. So here we have a indole ring. Okay, so that is the structure of 𝘂𝙎𝑚𝑏. Now if we talk about the uses: erectile dysfunction, orthostatic hypertension, then adjoint in the weight loss, study of the ANS and the synaptic tone. For all that, 𝘂𝙎𝑚𝑏 can be used. Side effects: again the same like the others: tachycardia, palpitations, hypertension, anxiety, agitation. Then we have headache, insomnia, tremors, nausea, vomiting, sweating, and dizziness. All these are the side effects of this 𝘂𝙎𝑚𝑏. So this was the last drug in this class, that is the alpha receptor blockers. Okay, hope you understood the video. So thank you so much for watching the video. Thank you so much.